Dr. Alan KRASNER, welcome. Tony, welcome. Thank you for joining me here live on the Valder Beebe Show out of Dallas, Texas. I hope your day is good.
Day's going well, Valder. Thanks for having me.
Well, thank you. I'm going to start with Dr. KRASNER. I'd like you to to define what our disease is we're going to be talking about today.
Acromegaly is the name of the disease, and it's a rare but serious disease. It's caused by a benign tumor in the pituitary gland. It secretes too much growth hormone. Too much growth hormone causes slow changes in the appearance of the face, causes enlargement of the feet and the hands, and it can also damage internal organs like the heart and joints of the body. This disease progresses so slowly that healthcare providers and even the patients themselves may not realize these things are occurring. And unfortunately, this leads to long delays before the diagnosis is made, and that delays the beginning of necessary treatment.
Does it go, doctor, does it go undiagnosed, or is it diagnosed as something else? How is that happening?
Well, I'd say more commonly it goes undiagnosed for long periods of time. Studies show the average time duration between the onset of symptoms and the time it's actually diagnosed can be 5 to over 10 years.
Tell me some of the symptoms again.
Well, oftentimes patients report a lot of pain in the joints, severe fatigue, numbness and tingling, and a whole host of other symptoms. But in addition to that, slowly over time, this excess growth hormone damages parts of the body, as I mentioned, including the heart, which can lead to heart failure. And it also causes sleep apnea and carpal tunnel syndrome and a whole bunch of problems.
You brought Tony with you. I'd like to switch to Tony. Tony, I think you have a personal journey that you can underline, support what the doctor is saying. Could you give us a little bit of your journey?
I can do that, Valder. Thanks for asking. My journey with acromegaly started when my shoes began to fit tight. I had constant pain in my hips. Valder, at that point, I didn't realize that those were signs of something much bigger. In 2015, I spoke with my primary care physician about the ongoing pain. He ordered some tests, which led to the diagnosis that I have of acromegaly.
And how long have you been diagnosed with this condition?
Valder, I was diagnosed in 2015, and I had surgery to remove my pituitary tumor in 2016.
I want to thank you for being here, and I want to thank you for sharing, Tony. Dr. KRASNER, is Tony's story average of finding out that you have this problem, or is it unique?
Well, Tony had a very typical course of acromegaly leading with a delayed diagnosis, but every patient is different. Some patients have those classic symptoms, and other patients have changes in their appearance. Some patients just have sort of a cluster of very common problems like diabetes, hypertension, sleep apnea, and carpal tunnel syndrome. Regardless of the presenting symptoms, it's very important to recognize this disease promptly so treatment, which is very effective, can begin. That's why I'm here with CRINETICS Pharmaceuticals, really working on raising awareness for this important condition.
Have there been changes in recent years? You know, technology is changing everything at the speed of life. Has there been any changes for caring or treating or eradicating this disease?
Well, yes, actually, very much so. As Tony mentioned, the first step in treatment is usually surgical removal of as much of the pituitary tumor as possible. Generally, this is pretty successful in about half the cases, as long as an experienced surgeon is doing it. But about half the patients do require medications for those patients who are not who do not go into remission after surgery. Those medications historically often required monthly doctor visits for deep, painful injections, but new medications have come out, and there are more on the way. And hopefully this will help patients live their lives and spend less time treating their disease.
I'm going to have to ask you this question, because this question, I told my audience you were coming, and one of the questions were, when a person is diagnosed with these kind of conditions, not just necessarily this one, there is a medication or something like usually to help them, but they're usually out of financial reach. How do you get the medication and be able to really afford it? And I know you're not an insurance person, but I hear that a lot. People say, yeah, there's a medication, but you know, it's $6,000, it's $8,000.
Right. I recognize there are a lot of challenges in the healthcare system these days, but you know, everyone is different, and every case is different. And I would just recommend starting to talk with the healthcare provider, establish whether or not someone might have this kind of condition. And if so, there are many ways to access medications, even with these challenges.
Okay, Tony, I want to ask you, you have this disease, acromegaly. How does it affect your everyday life, both physically and emotionally?
Great question. Living with acromegaly changed a lot about my day-to-day life. Physically, I've dealt with joint pain and fatigue, the enlarged hands and feet. Also, emotionally, I've learned to give myself grace, find support systems, and I've also found it important to share my story and give encouragement to other people living with acromegaly.
So you're living with the disease. How are you physically now?
Physically, I'm doing well. I have had a few surgeries that I'm living through, but right now I'm in a very good space.
Well, I pray for you, and I wish you the best that God has to offer, and I really appreciate you sharing your story. This is why I get to do this show, is I get to talk to people like you, Tony. Thank you very much.
Thank you for having me, Valder.
Okay, doctor, you want to wrap up and tell people where they can get more information, or if they need help, how do they go about it? Is there a place online for them?
Absolutely. So, you know, it's a very treatable condition, acromegaly, but it can't be treated unless it is first diagnosed. And this is why we're so focused on awareness. And we encourage everyone to talk to their healthcare providers and learn more about this at acromegalyreality.com.
I want to thank both of you fine gentlemen for coming on the Valder Beebe Show live out of Dallas, Texas, to talk about something that we have not heard a lot about. I thank you very much. Have a great day.
Thank you.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Beebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/Valder Beebe Show and stay connected as I interview the world's most fascinating people.